Right now, former President Jimmy Carter is in hospice care at home. Carter recently had been in and out of the hospital for short stays. The 98-year-old has decided to spend his remaining time at home with his family and receive hospice care instead of additional medical intervention. With this news, some of you may not know exactly what hospice care means and what goes on at this time. So Dr. Payal Kohli joins us this morning to help explain. Thanks for coming in.
My pleasure.
What is hospice care?
You know, hospice care, Corey, is a philosophical shift. So mostly in medicine, we think about kind of curing the disease and we think about quantity of life. When someone starts to think about hospice care, it's more about the quality of life, their comfort, surrounding them, you know, with a multidisciplinary team of doctors, nurses, social workers, spiritual leaders that can really help them and their families sort of have dignity at the end of their life.
What goes into deciding this is the time for hospice care?
So, you know, you have to qualify for hospice if you have a life expectancy of less than 6 months.
Oh.
So if your disease kind of ran its course, it should have a life expectancy less than 6 months. So you can imagine it can be conditions like, obviously, you know, terminal cancer, but also things like advanced dementia, chronic kidney disease, advanced heart failure, advanced COPD. So that kind of opens the door for the discussion, and then it's really sort of up to understanding the patient's kind of goals and values and what they want in terms of maximizing the quality of their life.
Does this always happen at home?
No, and in fact, that's the interesting thing. So hospice is more a care philosophy. It's not where it happens. So hospice can happen in any location, depending on what the patient and the family members want. It can, of course, happen at home. And when it does, it's very nice because they have a hospice nurse that comes and visits. They set you and your caregivers up with kind of all the things that you need, medical supplies and equipment. People do home visits as well. But it can also happen in the hospital. It can happen in a nursing home. There's even hospice care facilities where people go to get hospice care.
And thank goodness for the nurses that work at those places, because I truly cannot imagine. Does this mean that medical intervention is not given when you're in hospice care?
That's a great question. So, you know, there's differences in the spectrum of hospice care. So if someone's death is imminent, then we do something called comfort measures only, where you really sort of withdraw everything and just maybe start a morphine drip and keep them comfortable. But for most people in hospice, we actually do continue chronic care medication. So, you know, you can imagine if somebody's on a blood pressure medicine, stopping that is going to make them feel terrible because their blood pressure is going to shoot way up. So you would continue that. But on the other hand, like a cholesterol medicine that prevents a heart attack 5 to 10 years later, that probably doesn't make sense, and it's another pill for them to take. So they do de-escalate medications, and people on hospice do tend to take fewer medications than those not on hospice, and they tend to have better control of their pain.
Does like a DNR usually come into place for hospice care?
You have to have a DNR.
Okay.
Because the hospice care, again, is really that philosophical shift that you're sort of ready to, you know, accept the last phase of your life and do it on your terms. But that's not a situation where you could be what we call full code, which means if your heart or lung stopped, they would not resuscitate you. So DNR, or do not resuscitate order, is mandatory to go into hospice.
And hospice care, is, you were kind of alluding to this, that it's a very short amount of time that you're usually in hospice care.
Usually, but you'll be surprised. Some people can even come in and out of hospice care. You know, if they get better and the disease gets better, it's not a one-way decision. But the data tells us that about half of the people who go into hospice care pass within about 3 weeks, and about a third of them pass as early as 1 week.
We hear the word hospice, you know, come into play often, and it's hard to understand what really happens unless you've been in that situation. So we really appreciate you coming in and letting us know what's going on with Jimmy Carter, because I know that he is a beloved president, whether you believe with his politics or not. You know, he's done some incredible things in his 98 years.
Yeah.
Thank you
incredible.
so much.